Today we're going to be talking about aminosalicylates. This class of medication is found in the first chapter of the BNF, known as the Gastrointestinal System. Aminosalicylates is usually used for Crohn's or ulcerative colitis. Common examples of aminosalicylates are mesasalazine, balsasalazide, ulsasalazine. These are newer class generation of aminosalicylates and have less side effects. Sulfasalazine is an older class generation which has more side effects. The mode of action of aminosalicylates is it reduces the inflammatory response to certain conditions such as Crohn's disease and ulcerative colitis. Usually we offer a tablet with a suppository or an enema for better efficacy. For mild conditions, we usually just use topical treatment alone. Aminosalicylates mainly have cautions more than contraindications. Cautioned in poor renal function. That's because its side effects would be a lot more prominent. Also cautioned in allergies to aspirin. That's because aminosalicylate has similar structure to aspirin, which is acetylsalicylic acid. And therefore, patients who are allergic to aspirin, they may experience similar reaction in aminosalicylates class of medication. Side effects can be cough, nausea and vomiting, gastrointestinal side effects such as abdominal pain, headache. It can also stain the body fluids yellow, meaning if a patient wears contact lenses, it can stain the contact lenses as well. And patients should be counseled on this side effect. Also, advise patient to avoid using contact lenses and potentially start using glasses. Other side effects can be pancreatitis, myalgia, cardiac inflammation, and a very rare side effect is Stevens-Johnson syndrome. Patients should also be counselled on bleeding disorders. This mimics flu-like symptoms such as malaise, fever, sore throat, but it can also cause bleeding, bruising, and purpura, which is a skin-like reaction that means there's purple spots on the skin and it can also be on the mouth. Interactions. Aspirin, as we said before, has similar structure to aminosalicylates. Medication that alter the gastric pH can affect the breakdown of aminosalicylates. For instance, PPI can increase the pH, which causes mesasalazine to break down quickly. This causes its efficacy to reduce. So, for patients who are already taking PPI, it's best to space out the medications. For instance, having aminosalicylates first, and then 2 hours later taking a PPI. There are other medications, such as azathioprine, which is an immunosuppressant that can be used for Crohn's or ulcerative colitis. In combination of azathioprine with aminosalicylates, it can increase the side effects of blood disorder. Therefore, monitoring of full blood count is essential. Mercaptopurine is also an immunosuppressant that can also be used. Sometimes it's used for cancer. It interacts with purine synthesis, so increases risk of blood disorders. An example question that could come up would be, what counseling should a patient receive when they are prescribed Pentasa sachets? A. Can stain contact lenses orange. Take 1 hour before meal. Common side effect is pupil dilation. Report any chest pain symptoms, or the mesasalazine granules can be chewed. The answer for the question is can stain the contact lenses orange. Thank you for watching. I hope you enjoyed the video. The next video will be about PPI, so stay tuned for that. Please subscribe and follow for more videos.